Okay, so sorry that it's been so long since I've made a video. I've been super busy. Right after top surgery, I spent a week just doing absolutely nothing. And then we moved into a new house, and I've been unpacking, and the place is still a mess. As you can see, this is our living or our dining room. Where I'm supposed to be able to eat, but it's covered in boxes. Because I'm just now like able to actually lift stuff up. So everything's been kind of just a mess forever. But this is my almost 4 months on T and 1 month post-op. Um, I'm sorry again, it's taking me so long. I've just been so busy. Um, my T changes are I've gotten a lot of acne on my face, as you can see on my chest, and on my back, if you can see it. But I don't know. I've also gotten facial hair, more like mustache. I've noticed some hair in here. It's also pretty light, except for my mustache hairs, which were always dark. They're just kind of thicker. I have to shave. I should shave twice a week, but I'm really lazy and shave like once a week. Other than that, my voice has dropped some more, and that's probably about it that I've noticed. I've gotten more thigh hair and more stomach hair. It's just kind of like more hair in general is basically it. Um, Post-op, I feel great, and I think I look pretty good. Side view, it's my tummy. But yeah, I mean, it looks pretty good. My nipples are pretty good. They get hard and soft, like they can poke out, and they go back to normal. My scar's not bad at all. It's um, it's partially healed over on the sides here. It's starting to like completely reconnect, and there's not much scarring. It's just a little bit pink and red. It's really not very bad at all. I've been putting silicone lube on it. Also, I have a scar stuff called Scar Zone, and I've been using that. I used it before on scars, and it worked pretty well, so I've just been using it on as well as my silicone lube like once or twice a day, just depending on what I'm doing. Um, yeah, and the I don't know. I'm healing pretty good. I'm still not pretty sore, but I'm still kind of sore in here. If you touch it, or if I stretch a lot and I haven't moved around, it gets kind of sore in here. Or if I lift stuff, it gets sore in here. I'm still kind of numb. I can't really. I feel it. It's like I can feel that it's sore, but I can't feel it. Like I get itchy sometimes around in here, and if I rub it to like kind of make it go away, it doesn't do anything because I can't feel it. Um, my scars are pretty thin. I have a few underneath the skin, big lumps I can feel right in here and at the edges on this side. But they're pretty good. They're a little bit crazy looking. They're not like exactly straight or curved, but I don't really mind that much. It doesn't bother me. I'm pretty much shirtless 100% of the time. Um, One, it's hot, and two, why not? I went to the beach and I went shirtless and just wore shorts, and it was so nice. Just, and it's weird because I thought that I would feel really strange and like I was naked or something because I've always had. When I went to the beach before, I wore like t-shirts on top of everything I wore. Um, so it's just been really nice. I haven't felt naked. I just felt normal, which is so great. Yeah, it's really hard to explain how great it feels to just walk around shirtless. I kind of forgot that like I ever had any kind of chest. I've already forgotten about it. Um, but yeah, my healing went great. I had to wear a little surgical binder with like a huge gauze thing on it, and then I had to wear little nipple gauzes, um, and they were all really good. I will link my transition blog under here. I kept that a little bit updated with some pictures of like my nipple sponges and stuff, and like right after, I tried to take a lot of pictures. My blog also has some of that on there that I just didn't have time to make a video, but I could take a picture real quick. Um, but no, everything's really good. I'm happy. I'm doing well. school starts in like a month. So I'm just trying to like get the house unpacked and everything before that happens. Yeah. Oh, also, I went to my doctor a little bit ago, I think about a week ago, and he lowered my dose. I was on 1 cc of 200 milligrams every 2 weeks, and I'm on zero point 0.7 or 140 milligrams every 2 weeks. And since then, my acne has gone way down. You guys should have seen it a week ago. My face was acne all the way around here. Just, it was awful. It was completely awful. And my shoulders were super broken out. Now you can't even see it on here. They're just, it's all dried up where it was from being on a lower dose already. Um, my shoulders are dried up. My chest is better. It's still pretty bad. My face is, it's mostly dried up stuff and stuff that I pick at. There's not really a lot of new acne. So he asked me if I wanted to go on acne medication, but instead I just said, let's wait and see if the lower dose helps, and it already has. And it's been like a week. But yeah, things are good. If you guys have any specific questions you want to know about my surgery or anything, you can ask me. I plan on eventually making a big video about my entire process with McLean Clinic and everything, as a resource for those out there, because when I was looking there wasn't a lot, but he's a wonderful doctor. I'd recommend him to anyone in the general area. Um, I loved it because it was less than 3 hours to get there, so it's definitely worth that paying. I think he's a little bit more expensive than a lot of people, but I didn't have drains, and I didn't have to travel by plane somewhere. It was close enough I could go up for 3 days and drive home, and it was really worth it. But I'll put that all in a different video. If anyone has anything else they want to say, let me know. I'll try to answer everything as swiftly as possible, and I will try to update again sooner than before, now that I'm a little bit more moved in. So, peace.